Hi, I'm Barb Dean. I'm a women's health nurse practitioner, and this is your daily dose on contraception. There are two different kinds of IUDs. There are the kind that contain copper, and there are the kind that contain progesterone. And of the kind that contain progesterone, there are three different options, and they each have a different amount of progesterone in them. So let's take a deeper dive into intrauterine devices, or IUDs. These are also known as LARCS, or long-acting reversible contraception. And the copper-containing IUD is good for 10 years. And when that's put in, it can be used as emergency contraception right away. It's a great choice for women who don't have very heavy periods, who don't have a lot of cramping, and who are looking for a hormone-free option. One of the things we know about the copper-containing IUD is that most women do very well on it, but about 1/3 will find that the cramping and bleeding is a little bit too much for them, and they may decide to have it removed before the 10 years or before they're ready to get pregnant because, again, the cramping is too painful or the bleeding is too heavy. But it's a great option for women who don't want any hormones and who want 10 years of contraception. When it comes to progesterone-containing IUDs, there are three choices. There is one called Mirena, or another one is Liletta, and that has about 52 milligrams of progesterone in it. And that IUD I'm going to show you. Now, I do not have any affiliation with the manufacturer of the progesterone-containing IUDs, and I'll put it over here for you. It has progesterone along this long T shape, and that progesterone acts on the cervix. It makes the cervical mucus super thick, so sperm can't get through. I'm going to show you an illustration that I use with patients. So with a progesterone-containing IUD, what happens is that the cervical mucus here becomes so thick that sperm cannot get through. The IUD is placed in the uterus. The progesterone acts just on the uterus. It doesn't prevent ovulation, so it doesn't have any effect on the hormones in the ovaries. Now, in the package insert, if you look, it will tell you that about 40% of women who use the 52 milligram containing progesterone IUD, that is the Mirena or the Liletta, that 40% will not have a period. But in post-marketing research, it's more like 60 to 70% of women will not have a period at all. And that's because the progesterone here acts on the lining of the uterus, and it causes the lining to be very thin, or what we call atrophic. Now that does another thing. It makes the environment here in the uterus what we call inhospitable to sperm. So any sperm that do get through that cervical mucus, that really thick stuff, if they get here, they're going to end up dying. So the sperm never get to the tubes, they don't get to an egg, and IUDs do not cause a fertilized egg not to be able to develop in the uterus. Now, when it comes to the progesterone-containing IUDs, the ones with 52 milligrams, that is Mirena or Liletta, they have high rates of patient satisfaction. Most women who use them love it, and they don't have this taken out early. When it comes to the other progesterone-containing IUDs, that's the Kyleena or Skyla, they have less progesterone and they don't last as long. They may last for 3 years, and what happens is about 25% of women who use them, they find that they will have irregular spotting and bleeding. But they're thinner and they're smaller and they're a little bit easier to put into the uterus. Well, let me tell you how we put an IUD into the uterus. So that can be done here in an office setting, just like this. And what I do for my patients is I see them ahead of time, and I evaluate whether or not their cervix will be open enough for me to easily insert an IUD. Now let me show you what the cervix looks like. I'm going to use my fist here. The cervix is kind of like a little donut. It's got a little opening called the os. And what I do is I examine a woman and I see if that os is a little bit open. If it's not open, there's a special medication that I can give to her to use a few hours prior to the procedure, which will open up that os, so it makes it much easier to insert the IUD. Then when a woman comes in to see me, when she's ready for the IUD, we've talked about it, she's signed the consent forms, the next thing I do is I do an examination and I see which way does her uterus curve, because our uteruses are not straight. They're curved, kind of like a C, and the uterus may curve toward her back or it may curve toward her bladder. And I want to know, because when I insert the IUD, I want to make sure that I follow that curve, so I have a reduced risk of causing any harm or going into the uterine muscle. So the next thing that I do is wash off the cervix very well. So we'll pretend that this is the cervix. I'll wash it 3 times with some betadine. And then what I do is this paracervical block. So I'm going to use some numbing medicine, and most of my patients don't feel me putting that in, but I'm going to numb the cervix so that when I hold on to the cervix to introduce the IUD, it doesn't hurt. Then after the IUD goes into the uterus, we cut the strings, and when we cut the strings, we curl them around the cervix. That way partners don't feel it. So in the IUD, of course it doesn't have this on it, this is just a model, but when the IUD goes in, the string comes out of the cervix and then we just curl it. And I typically curl mine, I don't know if you can see that, I curl mine so that they go to either 3 o'clock or 9 o'clock. Think about the cervix like the face of a clock. That way, when a woman's having intercourse, her partner won't feel it. The next thing that we do is we have our patients come back 6 weeks later and we check to make sure the IUD is in the right place. And the way we do that is we do a speculum exam, we look inside and see, oh, is that string still curved around the cervix? If it's not, that's okay. Sometimes that string will migrate up into the uterus. And what I do is I do an ultrasound. And when we do the ultrasound, we're looking to see if the IUD is in place, because the IUD will show up on an ultrasound. It's really, really easy to see. Now my patients ask me, well, oh my gosh, what are we gonna do if the string isn't there when it's time to remove it? That's okay. We have special instruments that we can use that very, very gently go into the cervix and can attach to the string and then gently pull that down so that we can pull out the IUD. People ask me, is it painful to put in an IUD? Is it painful to take it out? Well, when I use a paracervical block and I do that pre-exam to see if the cervix is open, most of my patients say, gosh, this is no big deal. I expected it to be a lot worse. And that's because when you go online and you read about other people's experiences, so often the people who have a good experience, they get on with their lives. They don't have time to write about a bad experience. But I want to reassure you, most women have a very positive, pain-free experience putting in an IUD. Now there may be a little bit of discomfort, but typically it is pain-free. What about taking it out? Well, taking it out is pretty easy. We just grasp the string with a special instrument. I ask my patients to cough really hard, and then I'm able to pull that IUD out pretty easily. Now, if you want more information about long-acting reversible contraception like intrauterine devices or IUDs, you can go to my website, as always, nursebarb.com. You can also hit subscribe and subscribe to more videos. And I hope this helps you get the information that you need so that you can make the right decision. And finally, when we think about IUDs, they're extremely effective at preventing pregnancy. In fact, they're 99.9% effective. That means only 1 in 1,000 women who use an IUD will become pregnant in a year. That's pretty good odds. All right, take care, be well, and as always, if you have questions or comments, please leave them below.